I think neuroscience is just incredibly fascinating. It's always changing. It's the new frontier. We're learning something every day.
I mean, after all, there is only one brain, and there are a number of specialties who have worked to try to understand it.
We began to put together a multidisciplinary team rather early. In some cases, it's everybody meeting in a room together and seeing one patient. In other cases, it's just coordinating our efforts, trying to create an environment at Children's where there's good communication between the various services.
For our brain tumor patients, we actually have the luxury of working with the Dana-Farber Cancer Institute.
And that has evolved now to one of the premier pediatric brain tumor clinics and programs in the country.
Obviously, we're the only level 4 pediatric epilepsy center in New England. Surgery is very intensive, work-intensive, and it's a very challenging part of the treatment of epilepsy, but it only applies to a relatively small percentage of patients with epilepsy.
There are certainly a lot of physicians, there are a lot of patients themselves, there are a lot of parents who tend to think of epilepsy surgery as something unusual and experimental. It really isn't. The brain that's left behind functions better once you get rid of this constant jamming or noise that's coming from the seizure focus.
And then they suddenly stop having seizures, they realize that, and they just suddenly, it's like the clouds are gone and the smile is there.
For me as a clinician, to have access to world-class individuals in neurology and neuroscience and in every other aspect of those specialties within Children's Hospital, I have this wealth of information that I can tap into.
Every child in the Neuroscience Center has emotional issues, emotional reactions to the illnesses that they're facing. Youngsters have both emotional and physical problems, and they go hand in hand. We like to approach kids as a whole.
We're always trying to improve the science behind the work that we do. And there's no better place than Children's Hospital and collaboration with other professionals here because of the number of children we see and the diversity of the needs that they have.
The way forward in terms of both understanding how diseases occur and developing new therapies, the foundation for that is basic neuroscience, because that provides us with the tools to understand mechanistically exactly what the diseases are doing to the nervous system, and also provides us with targets for the development of new treatment strategies.
It's very wonderful and really state-of-the-art to have nurses that just deal with neurological issues.
With all of the miracles of modern medicine now, the diagnosis has been made, and now we have to go about a plan of treatment and figure out how to deal with this problem in a way that's going to make the child whole and keep the family in good shape as well. And I tell them that I think that they're very fortunate that they're in the hands of an institution like the hospital.